All right, we're back. I'm here with the expert Dr. Mark Page, and we're talking about Invisalign. And Mark, we find that this works for most people. I mean, almost all people, but I suppose there are a few people that we found that it just doesn't work for. Do we know why that is?
So there are a couple factors that we're not completely understanding, but majority is the strength of their prescription. That's probably the biggest challenge we have.
Sure.
When it's just a really
It's just
extreme.
so far along.
But we've had several with very high prescriptions that they love it.
Sure.
And so until we kind of try, it's hard to say who's going to work and who's not.
And what percentage do you think is really working for people? Because it seems like it's a pretty high percentage.
Yeah, so we're 90%.
Wow.
Yeah.
Yeah, so 90%. And what I love about you guys is, you are constantly researching and collecting data and improving the system. And I think, again, this is something a lot of people just don't know about. And, you've really improved it and you've really kind of figured it out, so to speak, but you've also made it more affordable. But you're also, you're not stopping, you're continuing to learn more about this. So you've got some clinical trials that might fit for some people. Look, guys, you might be able to get in a free clinical trial to see if this works for you. And so you can contact Dr. Mark Page for that, see if you can get into that and go through that, because that'll help you continue to improve your system, right?
Yeah, so we're looking for people with all kinds of different prescriptions.
Yep.
So that way we can understand better
Ages, backgrounds,
prescriptions, medical conditions, eye conditions. So we're trying to understand better the techniques, the designs to improve it for everyone. But I think one of the nice things, David, when we try those, if we're just not successful or not getting the vision that we really want, it is really reversible. Mm-hmm. Unlike the surgery where it's kind of this is it.
Well, it's permanent too.
Permanent.
Yeah.
It's it's really not a permanent change, so it allows us that flexibility.
Sure. So whatever, as we change the shape of the eye, if it doesn't entirely perfect the vision like it does in 90% of the other people, worst case scenario is your eye is going to change back to
where
the
it was,
shape.
right.
And
you're wearing your old glasses, you have to wear your old contacts like you did before.
Sure.
But it's not a permanent change where, you've lost part of your vision or worse.
Yeah, so this is great. So guys, if you want to sign up for your first free consultation to work with Dr. Mark Page or someone in his staff, his medical staff, you can do that. Also, if you want to see if you qualify to be in some of these clinical trials to see if this works for you before you move forward with doing the procedure, that's also an option for a lot of you. So go ahead, take a look at the details now and go ahead and give Dr. Page a call.